Hi, this is Sam from Continuum Physical Therapy, here with Brandon from Portland Physical Therapy. We're here to talk with you about trigger point dry needling. It's a service that both of our clinics provide for patients, and we get a lot of questions, so we just wanted to have a video to kind of answer some of those. First, what is dry needling? So basically, it is a technique to release tight bands of muscle using a monofilament needle. It's called dry needling because it was initially developed by a couple doctors who were attempting to release trigger points by injecting cortisone and lidocaine into the muscle. What they were finding is that when they got a good twitch response or a contraction of that band of muscle, they were getting a positive response no matter the solution that was injected. So then they attempted to do the same injection into the trigger point just without using a solution, and they were finding a lot of times that was just as effective. So then the next question is what's a trigger point? So a trigger point is basically just a tight band of muscle, commonly referred to as a knot, that it can definitely be a source of pain and dysfunction in the muscle. The research on dry needling is relatively new, but a lot of the research is pretty promising on the ability of dry needling to release some of those trigger points and decrease pain and improve function. So the next question that we get a lot is, does it hurt?
Yeah, so that's a question that we both get from most of our patients. It's a little bit of a concern for them, and the answer is it kind of depends. It depends on the patient. I've had a lot of patients, we've both had patients that have said that they hardly feel the needle when it's in there as we're releasing the trigger point. Other patients have said they feel it and it's a little bit sore. Usually after dry needling, what we tell our patients is that about 24 to 48 hours, you might feel like it is a little bit more sore, like you had a hard workout in that muscle, or it might feel a little bit bruisey. But after that 24 to 48 hour period, oftentimes that discomfort subsides, and then your baseline pain or tightness is better. And that's the hope of, as we're doing dry needling, is that we're releasing those baseline symptoms. So one of the other questions that patients will ask is, how many times do I need to get dry needled? And again, the answer is, unfortunately, it depends. I mean, what we're doing is to find these trigger points that Sam alluded to, is we're using our hands to palpate and feel the tissue. So as we feel those trigger points, we're then putting in the needle to try to release them. And on your subsequent visits, we'll try to find those trigger points again to see if they've been released and they're staying gone, or if they've come back, or if there's other trigger points in different muscles that maybe need to be addressed to try to release them as well. So it does depend, but it shouldn't take too many visits to truly release them, just a few to get them gone. And then what we both do is we use some of our other techniques, manual therapy or therapeutic exercises, to try to teach you ways to make sure that those trigger points don't come back. A very common question that we get, Sam, is that is dry needling acupuncture?
And the simple answer is no. It's not the same as acupuncture. We don't have the training to do acupuncture. Our approach is relatively simplistic. It's a pretty mechanical approach. We palpate to find a trigger point, and we use a monofilament needle to attempt to release that trigger point. So no, not the same as acupuncture, although similar needles. So then we'll show you a quick demonstration. All right, I'm here with Brandon. Try to show you what it looks like when you elicit a twitch response in a trigger point. Although Brandon's sunburn is probably bothering him more than his trap is. So what we're looking for, we're going to palpate and look for tight band of muscle. And then attempt to get a twitch out of it. So you can see a few there, a little stronger one. Make sure it stops twitching.